Now, this second part is about the cardiovascular risk register. So once patients have been displayed to you and you've reviewed their charts and coded them with K22, it then introduces the patient into the cardiovascular register. How do you access that? Well, on the left hand side here, click on Reports, then click on IPCRN Tools, then click on Cardiovascular, and you'll see there's an option here for the cardiovascular risk register. Double click on this, and what this will do then is that it will look for any patients who you've coded with K22 or having risk factors for cardiovascular disease. I've put in some limiters here on cardiovascular condition, and also you can say only show patients within a certain period or time frame, but it's set as default as the last 3 years. So leave the settings the way they are, click OK, and what this will do then is pull back anybody you've coded with K22. So the whole purpose of this is to display patients to you who you may want to keep an eye on in the future. So this shows, there's a small disclaimer here on the top because this is a beta test release, and we're validating this tool over the next 2 to 3 months. But essentially what it does is it says 11 patients here are currently coded with K22. We remove out duplicates in case you've got multiple versions of the same patient. And what we do then is show you an overview of those patients. So you can see there's a test patient here, Joe, there's a test patient, Mary and Joe blogs. What we show you then as you go across is that the patient contact number, GMS, date of birth and sex, these are all test patients with the same contact details, and you can see going across then you get kind of a dashboard view of this patient and how they're currently doing. So this shows you the most recent values. So this patient, Joe Blog 633, has their last systolic blood pressure is 120, their last diastolic is 90, the last BMI recorded is 46.57, no abdominal circumference recorded here, they are a smoker, no EGFR there, but total cholesterol last time was 430 with a HDL of 0.9 and an LDL of 2.2 and triglyceride of 2.7. Their last HbA1c is 11.9, and they have been coded with diabetes, either type 1 or type 2, and they've been coded with some factor for a history of cardiovascular disease. And what that ties back into is, if you remember from our last tutorial, there are these risk factors of acute MI, ischemic heart disease, cardiovascular disease, other cerebrovascular disease. Well, if they've been coded with any of one of those, this will come up as a yes in the history of cardiovascular disease. And when it comes to diabetes here, going back to our finder, if they've been coded with type 1 or type 2 diabetes, that will come up as a yes here. So this gives you an overview or dashboard view of any patient in the practice who's been coded with K22. And you can limit them based on time, so seen in the last 3 years, 2 year, 1 year, or whether it's just an active condition or not. But that gives you an overview of the cardiovascular risk register. So the idea here is that you run the cardiovascular risk finder, which I showed you in the last tutorial, to identify potential patients. You then look at the charts and code them with K22 if they have risk factors for cardiovascular disease. And once you do that, then they're introduced into this cardiovascular risk register, and they'll stay there. So at the click of a button, you can keep an eye on these at-risk patients, and you can see how their blood pressure and these other type criteria are and how they're scoring, and the idea is that the more of the values that they have which are out of the normal limits, the higher they'll be displayed in the register. So you can see this person here is 1, 2, 3, 4, 5, 6, 7 criteria are outside normal limits, where the next person is 1, 2, 3, 4, 5, 6, 7 as well, and then it'll go directly down. So 1, 2, 3, 4, 5 for the next patient, and then further down. And that's it. So that gives you an overview on the risk register. The last tutorial was on the cardiovascular risk finder, and our next tutorial will be on the cardiovascular risk uploader, which sends anonymized data to the IPCRN should you choose to, and then gives a practice report back to you based on these patients. Thank you.